I'm now going to tell you about chemotherapy that we give sometimes after you've had your breast cancer removed. Again, we look at your cancer, we look at the features of you and decide whether we think the cancer's probably not going to come back even if we don't give chemotherapy, or whether we think there's a very high chance that unfortunately some cells have spread away from your breast and will slowly grow and eventually sort of come back, although they were there all the way along. These are the cells that we want to kill off by giving drugs, and that's what chemotherapy is, it's drug therapy. Now, if we think that there's a high risk of your cancer coming back, and there always is some risk, then we may recommend a course of chemotherapy. And a course means giving injections, normally every 3 weeks, but there's a whole range of different ways we give it, and normally for 6 lots, but again that's very variable. And if we give a course of chemotherapy, we know this will reduce the chance of the cancer ever coming back, and it will increase the chances of you living without the breast cancer ever recurring ever again. Unfortunately, we all know that chemotherapy has side effects, and some of these can be unpleasant, but we look at that as a short-term unpleasantness to try and gain long-term chances of you living happily ever after. Now, the side effects are much less than they used to be because the drugs are less poisonous, but more importantly, the drugs we give with the chemotherapy are much better at stopping you feeling ill. Now, everyone dreads losing their hair on chemotherapy, and unfortunately that is quite common, but it will grow back again once you finish the treatment. And sometimes we use a cold cap, which is a very cold cap that we put on your head while you're having the treatment, that may reduce the chance of your hair falling out. The other thing people don't like, obviously, is feeling sick or being sick on chemotherapy. So we always give very strong anti-sickness drugs if needed while we're giving you the chemotherapy, and we'll give you lots of these drugs to take home, which advise you take whether you feel sick or not for a few days. And these drugs are loads better now, and it's pretty rare that people are feeling dreadfully sick for ages. Another thing we commonly worry about is that your immune system will be very low on treatment. So we give nowadays the minimum dose that we think will do the job, and we also sometimes give drugs to stop your immune system dropping. That's just one injection the day after your chemotherapy, and this makes it much less likely that you'll get an infection that will end you up feeling very ill or ending up in hospital. However, if you do feel ill and get a high temperature while you're having chemotherapy, you'll have lots of phone numbers to ring and lots of support for advice as to what you should do. There are also many other side effects of chemotherapy. It can make you very tired and feel very washed out. Though there isn't much you can do about that, it will just wear off after a few days. It can also make your mouth taste, everything tastes generally horrible, and there's a variety of mouthwashes we give for that, or using fresh pineapple, but again it's a temporary thing that will go away. Okay. We'll also advise you, if you're young, not to get pregnant while you're receiving chemotherapy, and also some drugs have very specific side effects that we'll warn you about, but on the whole most people just feel generally groggy for a few days or a week after each cycle, at the worst normally, and then they'll pick up and feel fine again. And hopefully there will be some life during your chemotherapy, and then the pros of that is that there's hopefully a much better chance that your cancer will never come back and you won't ever need treatment again, and your life expectancy will be increased. Before you receive your chemotherapy, this will all be explained to you by me or whoever you see, and you'll also have a session with the nurses who give the chemotherapy, who will show you around the chemotherapy unit if you wish, and explain all the pros and cons of the treatment, and give you a specific information leaflet about the specific drugs you will get, and you'll have ample opportunity to ask plenty of questions about it. No one wants to receive chemotherapy, but you have to look at it as a very unfortunate treatment that we may recommend. We'll always give you the choice that you don't have to have it, but you can always stop the treatment if you and I find that it's just not suiting you at all. But if it is recommended, then it's probably worth giving a go. As well as the other treatments, we sometimes give anti-hormone treatment after your breast cancer is removed. Each cancer we do a specific test on to see if it's the sort of cancer or not that is likely to be influenced by whether you have estrogen around in your body. Some cancers grow very readily if there's hormones around, and that's what we might want to stop, and others it doesn't make a difference. But about 75% of the time breast cancers are hormone sensitive. If we think there is a significant risk of your cancer coming back, we may recommend a course of tablets that you take for normally a minimum of 5 years, but sometimes longer than this and sometimes shorter than this. If you're still having your periods, in other words premenopausal, we'd normally recommend a drug called tamoxifen for 5 years. This is a daily pill that most people get on very well with, and we've been using it extensively for over 30 years, so there's a huge experience. Most people, as I said, do get on fine with it, but any drug can cause side effects, and the most common of these are hot flushes. Some people gain weight, but most don't. Some people find that they get problems with vaginal problems, either dryness or discharge, but these are generally rare, and if you are getting side effects, we can always think of alternatives. These again will be discussed when you come for your appointment. If you're not having your periods anymore and you're postmenopausal, then we sometimes still use tamoxifen if we think it's suitable for you, or we more commonly use drugs that dry up the remaining bit of estrogen you're making. And these drugs are called aromatase inhibitors. And there's 3 ones we mainly use. One is called Arimidex or anastrozole, one is called letrozole or Femara, and one is called exemestane. All of these drugs work in a very similar way, and they're slightly better at stopping your cancer coming back than tamoxifen in some patients. On the whole, they cause less hot flushes than tamoxifen, but they do cause some patients to get slightly achy fingers or joints in general, but not normally very bad. They can sometimes cause hot flushes, but normally less than tamoxifen, and occasionally they can cause some slight thinning of your bones that you would never notice, and we monitor this with bone scans and modify the treatments if necessary. However, most people get on with these drugs extremely well and take them for 5 years, and they generally at least halve the chance of your cancer coming back compared to not taking them. And the effects still work even after you stop taking them after the 5 years. So again, if you're prescribed these drugs, we'd recommend that you take them, and if you don't get on with them, don't be ashamed, just discuss it with us, and we'll see if there's any alternatives available for you.
Hello, my name's Sarah Caskey and I'm one of the sisters here in the Headland unit. I lead a team of around 27 nurses and we deliver day case chemotherapy. So your first contact with the Headland unit could well be in the form of the pre-assessment clinic that we provide here in the Headland unit. When you see the oncologist, the healthcare assistant should book you in for a pre-assessment, and you should be coming here around about a week before your first chemotherapy appointment. You will be given written information about your treatment as well as verbal information, but at this point you can have a question and answer session which hopefully will answer all the questions that you may have or some that you may have thought of during the session. Most of the information will about some of the side effects that you may experience having chemotherapy. However, we will also be giving you information with regarding contacting the Headland unit or Lowen ward out of hours. At this point we will also orientate you to the Headland unit so that you feel comfortable knowing where you'll be coming to and what to expect. During your pre-assessment you will be advised that sometimes we do experience delays here in the Headland unit for a manner of reasons. We do endeavour to provide really high standards of care, but that sometimes means that there are delays in your treatment time. Bearing this in mind, we would recommend that you keep your full day free on that day of your appointment. One really important aspect of the Headland unit is that we have a great team of the League of Friends with us. They are able to provide hot drinks, snacks and sandwiches throughout your day with us. We hope that we cater for all your needs here in the Headland unit, but if you have any concerns, please do not hesitate to contact myself or Bridget Law, the other sister here in the Headland unit.
The chemotherapy was a milestone, something my family were very concerned about, but I was just really positive that I had to do. It wasn't as bad as we all thought it was going to be. I was extremely tired, spent a lot of time asleep, but I wasn't sick once throughout the whole event, and I think that was what I was most afraid of. I've got visions of spending all my time sitting next to the toilet, but not once was I sick. So the side effects didn't seem so bad for me. The experience shunted on. Once you got to the halfway mark, you felt as though you were coming towards the end. If it's like ticking a box every time you've had your chemo, that's one less you're going to not have again. The worst was losing the hair. I will not lie there. It's not a nice thing. But look at it now. This is only sort of, I suppose, 8 months of hair growth now, and I'm just chuffed to bits that I've got a lovely head of hair again. And so the loss is nasty while it's there, but there is light at the end of the tunnel, in that your hair will grow back. And I know we're all impatient. I'm impatient for it to get even longer than it is now, and I think that's just human nature. I started taking tamoxifen after I'd had the radiotherapy, which most of us are on, depending on your state of menopause as to what they give you. The biggest side effect of the tamoxifen is the hot flush situation, which ladies will be familiar with if they are postmenopausal. In my case, I was premenopausal, so it's frustrating, laughable. You get used to wearing lots of layers of clothes because you need to be able to sort of take a few off to make yourself cool again. I actually enjoy going outside in the cold sometimes, and people laugh at me because I just need to cool down. And I know this is going to be there for sort of 5 years while I take the tamoxifen, but I think the benefits of tamoxifen way outweigh the actual hot flush situation, which will eventually end, I know.